Welcome to Wellington Orthopedic and Sports Medicine. With 29 physicians and 7 locations throughout Cincinnati, we are the largest and most experienced musculoskeletal healthcare provider in the region. Please take a moment to hear from our physicians and partners.
Our goal is to be the best musculoskeletal care provider in the Midwest. And so we've invested in some of the most advanced imaging technology. We've partnered with radiologists to read our imaging technology. We have brought on the best physical therapists that we could find. So we try to, all the way from diagnosis through treatment through rehab, be able to offer people what we think is the best care. One of the nice things about being in Wellington is by having such a big group of physicians, you have a support system around you where if you don't feel like you can do the absolute best for your patient, you've got partners that you think you can.
I think that's one of the most enjoyable parts for me professionally. There's not a day that goes by that I don't have a collaborative discussion and seek counsel from some of my partners to get the best advice from really quality guys. And when we talk about the collaboration, that's not just the physicians, that's our assistants, our nurses, our physical therapy team, and we are constantly talking and communicating. It makes your day more interesting, but I'd really like to think that it makes the patient's care hopefully seamless.
At Wellington, we have some of the best trained orthopedic surgeons in the Cincinnati and tri-state region, and I would say in the United States. We've all had orthopedic residencies here in the United States. We've had, many of us have fellowship training, super specialized in some area of orthopedics and musculoskeletal surgery. Many of us are teachers at the university in Cincinnati here. We have a fellowship program here as well. So you're going to get the best care and top-notch service anywhere in the state.
Well, I think the Wellington experience for patients is to come to a place that has a Mayo Clinic-like model, where we have doctors from various specialties. We have surgeons, physicians, therapists, people who do neuromuscular specialty, even oncology. And so it's a place where you can go and have really just about anything that you would need to get even the most complex problem solved.
I think one of the strong points about Wellington, what I enjoy about Wellington, is that all of the physicians and surgeons in Wellington continue to strive to be better tomorrow than they are today.
We've trained hard and have worked hard to surround ourselves with the best team of people to give the care that we want to give. We're always trying to improve. We're always trying to do what's better for our patients. We're trying to think of our care from the patient's perspective. It's more satisfying for us. It's better for our patients.
When we choose our new physicians coming up and the people that we affiliate with, our general rule is, would this person be somebody that I would take my own family member to?
We're going to provide a very good personal care and treating each individual like they're the most important person in the room.
Patients come to us because they know they're going to get patient-centered care. But they also know that they're going to work with doctors that have been the ones that have invented some of the surgical techniques and the prostheses, continue to do research and teaching. And that's one of the reasons I've stayed connected with all this, because it just makes me sharper. I'm with people that around the world and around the country that really have the best thinking and development ideas about this. And while I try to contribute as much as I can, I really stand on the shoulders of giants.
In today's day and age, we really need to make a huge financial investment, not only facilities, but also behind the scenes, stuff that you guys don't really see, but I think you can appreciate. For instance, we've invested over $1.5 million in our electronic medical record, tying all of our 7 locations together so we can communicate within all of our 29 physicians. We have a picture archiving system, which is a digital x-ray system. Each one of our offices is going to have that within the next year. That's a tremendous amount of financial and manpower investment, but it's all done to bring a quality of care to our patients that I really think that in today's day and age is indispensable.
We came up with what's called a multimodal method, and what that is a way to use medications for the brain, the spinal cord, the nerves, and then the surgical site in ways that don't so heavily require narcotics. So for example, in the last 8 years, I have never used a narcotic pump after surgery. We don't put people to sleep, particularly after total knees. They get blocks and they're comfortable and they wake up alert and able to participate in therapy very quickly. And as a result, they end up really getting through the surgery with not only faster recovery, but they're far more satisfied. I do stay really busy beyond just the local care because I contribute to textbooks and write articles and lead research projects and then travel quite extensively throughout the world, both as a guest professor but also in mission work. So those are things that I think add to the depth and richness of the Wellington experience.
Most rewarding part of my job is to have someone who comes in with a bad injury, fearful that they're never going to function well again, and have them walk out of here functioning well. It's just wonderful.
I think the most rewarding thing for me is seeing patients get better and getting back to what really inspires them. Just this week I had 2 patients who really needed to get back to their activities, and one in particular is a musician, has a collector's item Gibson guitar, just is dying to play that, but his elbow wouldn't let him do it. And today he promised me in the office he's going to bring that guitar in and play it for me. So that puts a big smile on my face when I hear somebody say that.
I think the most rewarding part for me is return to play, return to function, and return to work with a smile on their face and a thank you.